This marks our 100th episode. Yes, we've hit a milestone, and I just want to take a moment to thank all of you, our loyal listeners, for tuning in, sharing feedback, and helping us grow this incredible community of healthcare professionals and administrators. It's been an amazing journey filled with insightful conversations and plenty of learning along the way. And on that note, given that we're here in our 100th episode, we are drawing some timeless wisdom from Benjamin Franklin. You've probably heard the old saying, an ounce of prevention is worth a pound of cure. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and my passion is to increase financial and business literacy for physicians. Episode 100, An Ounce of Prevention, a tribute to Ben Franklin on our 100th episode. Hello and welcome back to Medical Money Matters, the podcast where we dive deep into the financial, operational, and strategic challenges facing medical groups today. I'm thrilled to be with you here today for a very special episode. This marks our 100th episode. Yes, we've hit a milestone, and I just want to take a moment to thank all of you, our loyal listeners, for tuning in, sharing feedback, and helping us grow this incredible community of healthcare professionals and administrators. It's been an amazing journey filled with insightful conversations and plenty of learning along the way. And on that note, given that we're here in our 100th episode, we are drawing some timeless wisdom from Benjamin Franklin. You've probably heard the old saying, an ounce of prevention is worth a pound of cure. That quote is attributed to him, and it holds as much relevance today as it did back then, especially when it comes to running a successful medical group. Now, while Franklin may have been talking about fire prevention, the message is clear. It's always better and often more cost-effective to prevent problems before they arise rather than scrambling to fix them after the fact. And that's what we're going to explore today, how proactive preventive strategies can protect your practice, improve patient outcomes, and ultimately save you money and stress in the long run. So let's dive in. Let's start by taking a closer look at this idea of prevention. In healthcare, we're all familiar with it from a clinical perspective. Vaccinations, early screenings, regular checkups, these are all preventive measures that reduce the likelihood of more serious and expensive health problems down the road. In fact, the entire concept of preventive medicine is built on the premise that investing in a little care up front saves enormous costs and even lives later. But here's the thing. The same logic applies to the business side of healthcare. Running a medical group, as you all know, comes with countless moving parts. There are financial aspects to manage, regulatory issues to keep up with, and operational hurdles to navigate. And just like with patient care, adopting a preventive mindset in these areas can make all the difference between a practice that thrives and one that's constantly putting out fires. So what does prevention look like in the context of managing a medical group? For starters, it means having a clear, proactive strategy in place, which we covered in episode 37, whether that's financial forecasting, risk management, from episode 30, or operational efficiency planning. It means anticipating potential problems and taking steps to address them before they spiral into bigger, more costly issues. And perhaps most importantly, it means creating a culture of prevention within your team, where everyone from your administrators to your frontline staff understands the value of being proactive, not reactive. To be clear, taking preventive measures may not always be the easy path. It can require time, upfront investment, and careful planning. But in the long run, the rewards, both financial and operational, far outweigh the costs. So now that we've set the stage, let's break this down a little more. What are some of the key areas where prevention can make a huge impact on the success of your medical group? I want to touch on a few major areas: financial management, compliance, operational efficiency, and employee well being. First up, let's talk about finances. A solid financial strategy is crucial for any medical group, and yet many practices don't put enough focus on preventive financial management. What do I mean by that? Well, I'm talking about things like budgeting, cash flow management, and financial forecasting. If you wait until cash flow problems arise or costs start spiraling out of control, it may already be too late to make the changes needed to keep your practice afloat. For example, let's say your group is struggling with cash flow shortages during slow seasons. By looking ahead, running financial forecasts, and putting contingency plans in place, you could have avoided that stress. Preventive financial planning might also include maintaining a healthy reserve fund so when unexpected expenses do come up, you're prepared. Case in point, there's one medical group we worked with that was always scrambling to meet payroll during the slower summer months. They were stuck in a reactive cycle. By introducing a more robust financial forecasting system and focusing on improving revenue cycle management, we helped them smooth out their cash flow and avoid those frequent crises. That's just one example of how prevention can take the weight off your shoulders financially, and we've seen this work time and time again. Next up is compliance and risk management. Now, this is a huge area where prevention is absolutely critical. If you've ever dealt with a legal or regulatory issue, you know just how costly and time consuming they can be. And unfortunately, too many medical groups only address compliance when there's a problem. Instead, we should be treating compliance as a continual, proactive process. This might mean regular internal audits to make sure your group is adhering to the latest healthcare regulations, whether it's HIPAA, OSHA, or any other set of evolving guidelines. A common mistake we see is medical groups letting their compliance practices fall behind because they assume everything is in order. But as regulations change, you need to be continuously updating your processes to avoid penalties, audits, or worse. Case in point, we recently worked with a group that had faced a hefty fine due to noncompliance with updated patient data regulations. They hadn't conducted a thorough audit in years, assuming their old protocols were still up to date. Needless to say, that oversight cost them both financially and reputationally. If they had implemented routine compliance reviews, they could have avoided the entire situation. Now, let's shift gears and talk about operational efficiency, another area where an ounce of prevention can save you a lot of headaches. Running a busy medical practice means you're often balancing scheduling, patient flow, staff allocation, and administrative tasks. When things go wrong, say when an appointment backlogs build up or patient wait times skyrocket, it's easy to fall into a reactive mode where you're scrambling to fix the problem after it happens. But what if you could prevent those problems from occurring in the first place? By utilizing data analytics, for example, you can identify bottlenecks in your workflow before they become major issues. You could spot patterns in patient scheduling and staffing, adjust accordingly, and avoid those frustrating delays for both your team and your patients. Example: one group we worked with was able to significantly reduce their patient wait times by investing in predictive analytics. They started using software to track and analyze patient volume trends and adjusted their staffing levels and appointment scheduling accordingly. As a result, they not only improved patient satisfaction, but also saw an increase in their overall operational efficiency, meaning less stress for everyone involved. Another of our clients has a robust performance dashboard and a set of key performance indicators that they visit as a leadership team on a weekly basis. As we reviewed in episode 53, they have their eyes on the important metrics and leading indicators, so they are all over any issues as they're getting started and can react quickly. And finally, we come to employee well-being. Now, this is an area where prevention really hits home. We've all heard about physician burnout and high turnover rates in healthcare, and these are major issues that can significantly impact your practice. The key to preventing staff burnout is to take a proactive approach to supporting your employees' mental and physical health, which we covered in episode 72. This might mean implementing flexible scheduling, offering wellness programs, or simply creating an environment where staff feel valued and heard. If you wait until your team is already burned out, the damage has often already been done. But if you invest in your employees' well being upfront, you can boost retention and create a more positive work environment for everyone. Here's another case in point. One group we worked with saw a dramatic improvement in employee retention after they introduced more flexible work schedules, hybrid work, and mental health support programs. These preventive measures not only helped reduce burnout, but also saved the group the cost and hassle of constantly hiring and training new staff. Now, let's pivot to the most obvious area where prevention matters: patient care. We all know that preventive care can lead to better health outcomes, but it's also crucial for the financial health of your practice. Encouraging patients to stay on top of screenings, vaccinations, and regular checkups means fewer urgent, costly interventions down the road. Preventive care also aligns with the growing emphasis on value based care. As the healthcare industry continues to shift away from fee for service models, medical groups that prioritize prevention will not only improve patient outcomes, but also benefit financially from better reimbursements. As an example, we've seen firsthand how one medical group significantly reduced their emergency department visits and hospital readmission rates by focusing on patient education and preventive care. They made it a priority to educate their patients about the importance of early detection and regular checkups, which led to healthier patients and a healthier bottom line for the group, given increased value based payments. Now let's talk about patient communication and education. Communication is key. It's one thing to encourage preventive care, but you also need to ensure patients understand why it's so important. Leveraging technology like patient portals, telemedicine, and automated reminders can be incredibly effective in this regard. It helps keep patients engaged with their health, which in turn leads to better outcomes and fewer avoidable complications. As a case study, there was one practice that implemented a simple but effective communication strategy by sending regular preventive care reminders through their patient portal. As a result, they saw an increase in patient adherence to preventive treatments and screenings, which helped both their patients' health and their practice's overall efficiency and financial performance. So far, we've covered some key areas where preventive strategies can make a huge impact, from financial management to patient care and employee well-being. Now, let's turn our attention to the financial benefits of implementing preventive strategies within your practice and, importantly, some actionable steps you can take to start being more proactive today. We've already touched on how preventive strategies can save you money in the long run, but I want to spend a little more time digging into the financial side of things. Because here's the truth: the upfront costs of prevention, whether it's investing in new technology, staff training, or even compliance audits, can sometimes feel like an added expense. But when you consider the alternative, the long-term savings can be substantial. Let's break it down with a couple of examples. Short-term costs versus long-term gains. Imagine your practice is debating whether to invest in upgrading your electronic health record system. It's a big upfront cost, right? But what if I told you that failing to upgrade could result in inefficiencies, compliance penalties, and even lost patients due to frustration with scheduling or billing errors? Those costs could easily outweigh the initial investment in a better system. This is where preventive measures shine. Investing in technology, training, or process improvements now can prevent expensive problems later. As a case in point, one practice we worked with kept putting off much-needed building maintenance to save money in the short term. After several years of neglect, they ended up with structural damage that required an expensive and disruptive renovation, far more costly than if they'd taken care of smaller maintenance issues as they arose. That's the perfect example of how delaying preventive action can lead to much bigger, more expensive problems later on. Another big reason prevention pays off is the shift toward value-based care models. Medicare and private insurers are increasingly rewarding medical groups that emphasize preventive care through higher reimbursement and better financial incentives. This is a game changer for practices that want to maximize their revenue while improving patient outcomes. For instance, groups that focus on preventive services, like chronic disease management programs, often see not only better patient results, but also financial benefits through shared savings programs or bonus payments tied to patient satisfaction and health outcomes. One of our clients was able to significantly boost their revenue by focusing on preventive care measures. They invested in patient education programs and regularly followed up on chronic conditions like diabetes and hypertension. By doing so, they were able to reduce hospital readmissions, which in turn improved their value-based reimbursement rates. Their physicians were also happier not to have so many stressful patient readmissions. So not only did they save money by preventing costly patient crises, but they also earned more through their incentive programs. Incorporating preventive strategies also serves as a kind of insurance policy for your practice's bottom line. Regular financial audits, maintaining a contingency fund, and even securing additional insurance coverage can shield your practice from unexpected crises, whether they're related to health regulations, market shifts, or even natural disasters. This proactive approach can protect your group from financial distress, keeping operations running smoothly and safeguarding your ability to provide quality care no matter what challenges may come your way. So we've talked about why prevention is important, but now let's get practical. What can you do to start implementing preventive strategies in your medical group today? Here are some actionable steps you can take to become more proactive and to safeguard your practice. Number 1, conduct regular audits. First, conduct regular financial, operational, and compliance audits. Don't wait for a crisis to figure out what's wrong. Identify areas of inefficiency or risk now so you can fix them before they become costly problems. This might include reviewing your billing processes, ensuring compliance with the latest healthcare regulations, or assessing your staffing needs. These can be done internally, or you can bring in an outside group to help. As we've discussed in episodes 8 and 70, these internal audits help to prevent embezzlement. Number 2, engage your staff. Next, engage your staff in ongoing education and preventive training. Make sure your entire team understands the value of prevention, not just in clinical care, but in the daily operations of the practice. Regular training sessions on compliance, patient safety, and financial management can go a long way toward avoiding mistakes and improving overall performance. Number 3, leverage data analytics. Use data analytics to predict and prevent problems before they occur. If you have access to patient data, financial reports, or operational metrics, don't just react to what's already happened. Use that data to anticipate what might happen next. For example, if you see a seasonal trend in patient volume, prepare for it ahead of time by adjusting staff schedules and inventory levels. Number 4, partner with experts. Lastly, don't hesitate to seek outside expertise. Working with consultants like those at Healthy Practices can give you an edge in identifying and implementing the most effective preventive strategies. Whether you need help with financial forecasting, regulatory compliance, or operational improvements, bringing in experts can save you time, money, and stress in the long run. We've covered a lot of ground today, and I hope this episode has given you a new perspective on how adopting a preventive mindset can benefit your medical group. Let's quickly recap the main points. Prevention is as essential in running your medical group as it is in patient care. By being proactive, you can avoid costly problems and ensure your practice remains financially healthy. Key areas for preventive strategies include financial management, compliance, operational efficiency, employee well-being, and patient care. While preventive measures may involve upfront costs, they almost always pay off in the long run by reducing risk and improving both financial and clinical outcomes. Taking action now, whether it's through regular audits, staff training, or data analytics, can save you headaches down the road and keep your practice thriving. As always, if you're unsure where to start, we at Healthy Practices are here to help. We've worked with countless medical groups to implement these preventive strategies, and we'd be happy to support your practice as well. Thanks so much for joining us for this 100th episode of Medical Money Matters. I truly appreciate each and every one of you who have been with us on this journey. If today's episode resonated with you, or if you have questions or topics you'd like us to cover in future episodes, please don't hesitate to reach out. We love hearing from our listeners. Make sure to subscribe, leave a review, and share this episode with your colleagues who might benefit from it. Prevention isn't just about avoiding problems. It's about building a stronger, healthier medical practice for the long term. Until next time, I'm Jill Arena, and this has been Medical Money Matters. Join us for our next episode where we'll continue on our journey to making your practice as successful as it can be. Front Office Revenue Cycle Education, an in-depth course on the impact your front desk has on your clinic's bottom line. This online, on-demand 2-hour course is led by seasoned revenue cycle experts who will teach your front office staff the importance of obtaining accurate patient demographic information, how to effectively collect money at the front desk, and their impact on the life cycle of an insurance claim. Available now online for $195 per person at www.healtheps.com under Courses and Force. Enroll your front office staff and watch your denials go away.